She is the first lady ophthalmologist of India to receive Nari Shakti Puraskar from President of India, the highest civilian cervical cancer and and on vision for the young. Presently, she is the chairman scientific committee of Jharkhand. Over to you, Dr. Bharti.
Thank you. Good evening, all. So, my topic is OPD practices in times of COVID and post-COVID era. So, the first take-home message what I want to give you is for the OPD is trials of the patient and the separate entry and exit of the staff and doctor and patients. The patients enter through a separate area. Whenever the patients come, they should be screened for fever. If there is no fever, then we take history of TOCC, travel, occupation, contact, clustering, unprotected occupational contact with cases or contacts, travel history to outbreak areas within 2 weeks, cluster with people who travel to outbreak area within 2 weeks. Symptoms of upper respiratory tract infection like cough, breathlessness, acute conjunctivitis within 2 weeks. If there is no fever and the history is negative, then the patient is seen in a regular ophthalmology clinic with routine universal precautions. If the fever is, there is no fever and these symptoms, some of these symptoms are present, then we look for ocular emergency. If there's no ocular emergency, we reschedule the appointment after 2 weeks. If there is an ocular emergency, we send the patient to the designated ophthalmologist and staff equipped with PPE and in a designated isolated clinic. And if the patient has fever, then we see for the ocular emergency. If there is no ocular emergency, we refer the patient for medical care. If there is an ocular emergency, the patient is sent to the designated ophthalmologist and staff equipped with PPE to see the patient in an isolated designated clinic. So we all know about the eye emergencies. So the take-home message for the PPE is that the Supreme Court has come with the order that even in the non-COVID areas, we have to use PPE. Now, where to use full PPE and where to use not full PPE. So the OPD areas are moderate risk areas, the triage area, help desk, registration counter, temperature recording station, holding area, waiting area, doctor's chamber in regular OPD, sanitary staff, the CSSD laundry handling staff. These are moderate risk areas. Here and 95 masks and gloves are okay. But the designated OPD for fever or the history and symptoms suspicious of COVID, this area and the sample collection area for COVID-19 is a high risk area along with aerosol generating procedure area. So here we have to use full PPE, that means N95, gloves, gown, goggles, face shield, head cover. Visitors attending OPD and the supportive services, which are usually near the OPD, administrative, financial, engineering, and security, they are low risk area where only triple layered masks will do. So the OPD etiquettes, the take home message is 1 attendant per patient policy, avoid bringing children, open door policy, use of PPE as per the risk zone. The patients and the attendants should come with a mask and pen, avoid cash payment, stop ANCT, direct ophthalmoscopy, contact lens trial, routine diffraction. Fever patients with eye emergencies and red eye patients are sent to the designated OPD room with designated ophthalmologist and staff with full PPE. Hand wash on an hourly basis by announcement from reception, because we need to tend to forget. COVID-19 pandemic emergency ophthalmic treatment consent form to be filled by patient or attendant if the patient is having fever or any symptom. And doctor is a must, but the handling of this filled form by the patient or attendant should be done after 72 hours. There must be minimal talking while examining the patient. Thank you.
Thank you, Dr. Bharti. Dr. Nagin.